Hello, can you hear me? Hello, students. Can you hear me? Am I audible?
Yes, ma'am.
Okay, I'll repeat again from the beginning. Okay, since I'm having some network issues, I will repeat again from the beginning. Can you all see the screen? Is it visible?
Yes, ma'am. Yes, ma'am.
Okay. Okay, so today we will be revising on the topic of ascites. So this is ascites. I mean, this is the normal abdomen, and this is the ascites abdomen. So from the picture itself, you can see that it's not normal. The abdomen is not normal, right? So let us see what do you mean by ascites. So ascites means what? Ascites usually occurs when there is accumulation of fluid in the abdomen. Understand? Means this is the abdomen and fluid is being accumulated, means fluid is present there inside the abdomen, and ultimately you will find that it's not normal anymore. It's not it. This is the normal one. I mean, this is the normal abdomen and this is the abnormal one, since there is fluid present in the abdomen. So this is about ascites, means presence of fluid in the abdomen, accumulation of fluid in the abdomen. Okay, so let's move on to the next, that is causes. What can be the causes of ascites? What is the reason behind the causes? I mean, what is the cause? Why this thing occurs? Okay, so let's see what can be the cause. It mainly affects the liver. You can say that. That is your internal organs or else visceral organs. It mainly affects your liver. So what happens in the liver? There will be enlargement of liver, means since there is accumulation of fats. Yes, so there will be enlargement. The liver will be bigger in size compared to the previous liver. No? The size will become larger or bigger in size, and ultimately it will lead to liver fibrosis. In liver fibrosis, what will happen? There will be scar. There will be scar in the liver. Understand? And ultimately it will lead to what? Growth of connective tissue, means the tissues whatever we will find in the liver, there will be some more like destroyed. It will be some more like destroyed, which will lead to what? Which will lead to certain, like what to say, certain problem, which will cause certain problem. Like for example, what? There will be what? Blockage in the There will be blockage in the blood flow, means the blood, it won't be able to come to the liver anymore. Understand? Means it won't be able to supply the sufficient amount of blood anymore in the liver, and ultimately it will lead to acute liver failure. Slowly and steadily, like it will lose the ability to function like previously how it was functioning. Normally the functioning is what? Metabolism, right? It metabolize, so it will gradually like lose the ability to metabolize. So this is the cause. Did you understand?
Ma'am.
Okay. And some of the causes are cancer and nephrotic syndrome. Cancer means abnormal growth of cells, right? And nephrotic syndrome, what usually happens in a nephrotic syndrome? There will be swelling, since there is some abnormalities going on in the nephrons. Understand? So that's why, because of that also, this ascites can occur. It swells in the eyes also in the nephrotic syndrome. I have shown you, no? Nephrotic syndrome, what happens? It swells the eyes portion, as well as what? It will affect the abdomen also, both ways. Okay, did you understand till this portion?
Yes.
Okay, So let's move on to the next, that is risk factors. So who are most likely to have this ascites? Who are at the risk of having this ascites? So first one is exposure to hepatitis. Exposure to hepatitis in the sense like hepatitis B. Hepatitis B is a main cause, or else you can say is a main risk factor. Understand? So in hepatitis B, what will you find? You will find some person will, if some people or some couples will perform some unsafe sex, if they are not using some contraceptive devices, contraceptive things like condoms, pills, and all that. So they are most likely to have all those kind of problem. That is ascites. The second is, or else next is, if a person won't remain, if a person won't get vaccinated for hepatitis B, so they are most likely to have this ascites. And next is using drugs like sharing of needles, right? If mostly we see in some younger people, like peer pressure, all these people, if they share needles, what will happen? They will be most likely to have this ascites. And the next is heavy or frequent alcohol use. If a person is too much addictive or too much addicted to alcohol, like they are at the risk of having this ascites. It will affect the liver. Understand? Next is certain medications that may cause liver damage. Means some medications are there which the liver is not able to handle those kind of drugs or else those kind of medications. So that's why this is the another like risk factors. Understand? Some medications. And the last is this chronic health issues, means who are having some health issues like who are having like say for example heart failure, means their heart is not working properly anymore, cardiovascular system. All right, so they are at the risk of having this ascites. And the next is kidney disease, and whoever are having some kind of kidney disease, like kidney problem, no? So they are most likely to have this ascites. This one also I have already mentioned, consumption of alcohol, like who are addicted to alcohol, they are most likely to have this ascites. The next is low protein diet, who are having less amount of protein, like for example fish, egg, all those chickpeas, lentils, all this, like who are not having like those kind of protein diet, like they are mostly likely to have this ascites. And the next is weakness and fatigue, like whoever are weak and like whoever are having fatigue and all, they are most likely to have this ascites. So these are some of the risk factors of ascites. I hope it's clear.
Yes.
Okay. So these are some various I mean some things like alcohol effects. Some things like this is not included in your syllabus, but just for your own understanding, just for your knowledge. So this alcohol, it affects the liver. Just now we have already discussed. I won't repeat this one again. Next is kidney failure. So it affects your kidney also. Like it hampers your kidney also, like excretory system, right? Excretory system. So it affects that one also, and it also affects your chronic heart failure also. Like it affects your cardiovascular system also. And the next is damage to brain function, means nervous system. It hampers the nervous system also. So overall you can say it affects all the system. Digestive system also it affects, excretory system also it affects, nervous system also it affects, and cardiovascular system also it affects. So overall you can say it affects all the system. Okay, so what are some of the precautions that we can take, like if a person is having ascites? So first one is abstaining from alcohol. So a person who is addictive to alcohol, they should cut out, they should completely stop this alcohol, having alcohol. The next one is consumption of low amount of salt. So they should consume less amount of salt. Understand? Means like previously, suppose say for example, they were having 2 teaspoonful or else 3 teaspoonful of salt. So they should like deduct slowly and steadily. Like they can start by like 1.5 teaspoonful like that. They can like they can deduct in that way. Next is some of the medical like treatment, how they are you how what is usually given, that is known as parenthesis, or else you can say ascitic tap or else parenthesis. Okay, so this parenthesis like it is what it is used for draining out the excessive fluid. This is the abdomen, understand? So it is used to drain out. Drain out means what? It is used to take out. Means drain out means whatever unwanted things are there, na? Unwanted things are there inside the body, that is fluid in the abdomen. So they are usually taken out with the help of syringe, with the help of syringe and a pipe. Understand, that catheter. So they used to draw out. They used to take out all the excessive fluid which is in the abdomen, and they are usually done. Why? They are usually done. The first one is diagnostic, like in order to know the condition of the patient. Understand? And the second one is therapeutic, like after knowing the condition of the patient, like we will be able to treat the patient, like by knowing the condition, right? So these are the two reasons why a person means because of this why a person usually uses parasites are these two reasons. The first one is diagnostic and second one is therapeutic. Okay, so this is the picture. So this is ascites, and they usually lie down in this manner. So this is it. So this is the drainage catheter. Then this is a drainage container. So they does in this way. Okay, is it clear, everyone?
Yes.
Okay, if it is clear, then let me ask you all some questions. Yeah, to likha.
Yes, ma'am.
Okay, what do you mean by ascites? Ascites का
Ascites.
हाँ.
Uh, when when fluid accumulate in the abdomen,
Okay.
it is abdomen, the fluid in the abdomen.
Okay, very good. Okay, moving on to the next. Tumpe Jilen.
Yes, ma'am.
So can you tell me what are some of the causes of ascites? Causes.
Mm,
Okay, you tell me what is the main organ that is caused?
yes, ma'am.
What is the main organ that is caused by this ascites? What is the main?
Um,
Hello? 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 Can you hear me? Tumpe, can you hear me? Hello. I think your network is not good. Okay, let's move to the next. Trishna. Trishna.
Yes, ma'am.
Can you tell me causes causes of ascites?
Ma'am, cancer.
Cancer. Okay. Anything else? What is mostly affected? Okay then. Okay then. Surajit Kalita. Hello.
Hello, ma'am.
Okay then. Surajit Kalita. Next then. Surajit.
Ma'am,
Can you tell me some of the causes?
liver failure
Okay,
and
liver.
cancer.
Okay. Okay, good. Next, Srijana.
Yes, ma'am.
Okay, can you tell me if there is liver failure? I mean, what is the cause? Can you tell me some more points more clearly? Causes
Cirrhosis.
cirrhosis of liver, na? Okay, because of this, what will happen?
Yes, ma'am.
Because of the cirrhosis of liver, what will happen?
Disease of blockage of blood.
Blockage of blood flow. Okay, very good. Okay, moving on to the next. Sheetal, can you hear me? Hello? Sheetal, am I audible?
Yes, ma'am.
Okay, Sheetal, can you tell me some of the risk factors of ascites?
Ma'am, nephrotic syndrome.
Nephro- Risk factors, risk who are at the risk of having this ascites? Who are mostly likely to have this ascites? Like what kind of people?
Mm, Ma'am, using unprotected.
Okay, means unsafe sex, right? Okay,
Yes,
yes, okay, which is known as what? Hepatitis, what? Hepatitis A, B, C, what?
no, no, ma'am.
Don't know. Hepatitis B. Understand? Can you see? Can you see the screen?
Yes, ma'am.
Okay, so hepatitis B is mainly caused by all these things like unsafe sex and using the same syringe while taking drugs. Na? Mostly we will see in teenager, you can say like who are younger age people. Na? They like to experience something. It's not it. So they are mostly likely to have like, this kind of thing that is hepatitis B. Okay. Okay, moving on to the next. Senkamchi, can you hear me?
Yes, ma'am.
Okay, can you tell me some other points? I mean, some of the risk factors apart from hepatitis B.
Protein diet.
Low protein diet. Okay, anything else?
Consumption of alcohol.
Consumption of alcohol. Okay, good. Okay, next, Salam Girija Devi.
Yes, ma'am.
Okay, can you tell me some other points?
Weakness and fatigue.
Okay, anything else? Some kind of what health issues, no? Like congestive heart failure. It's not it. And some kidney disease. Okay. Okay, then moving on to the next. Rudolph.
Yes, ma'am.
Okay, Rudolph, can you tell me some of the treatment? Like what precautions can a person take?
Yes, ma'am.
What can a person do? Like if a person is having ascites, not some treatment.
Uh, that parent paralysis.
Paracentesis. Okay. What is usually done there? What is taken out?
Using
Uh-huh.
the f-
The fluid.
using I don't the fluid is taken out
Okay. From where? From the head, from the neck,
from
from the abdomen, from where?
from abdomen.
Abdomen. Okay. Okay. Good. Next, Rifen. Rifen. Rifen Pale. Okay. Then next, rich person.
Yes, ma'am.
Okay, rich person. Can you tell me some other points apart from paracentesis?
Tapping of ancestors of often carried out in the ward area and can be used for two reasons, diagnostic and therapeutic.
Okay. Okay. Anything else? What they should cut out? Previously, we have mentioned, no, like risk factors, consumption of alcohol. So what they should cut out? A person is drinking alcohol too much, addictive to alcohol. So what they should do as a treatment? They should drink more alcohol, or they should like stay away from alcohol, or what they should do?
Drain excess fluid.
Huh?
Stay away from alcohol.
Yes, abstaining from
Yep, stay away
alcohol.
from alcohol.
Okay. Anything else about salt?
Alright.
Mhm. They should consume more amount of salt, or they should consume less amount of salt.
Less amount, less amount of salt.
Less, na? Okay.
Less
Okay, you
amount of
should.
salt. Mm.
Okay, okay, good. So I guess everyone is clear about today's class. Ascites. Is it clear?
Yes,
Everyone?
ma'am.
Okay.
Yes, ma'am.
Okay then. If it is clear, then it's good. All these are important for your exam. It will come in your exam. Alright, your final exam, it will come. Okay then, that's all for today's class.